Culture often frames adolescence through the lens of the moody teenager. We've been conditioned to expect eye-rolling, slamming doors, and sudden withdrawal, labeling these behaviors as a normal, if difficult, developmental phase. This creates a significant clinical blind spot. While adults often look for sadness or lethargy as the primary signs of depression, the condition frequently presents in teens as irritability and a bad attitude. There is a specific threshold where behavior becomes a medical concern. When changes in energy, sleep, appetite, or interest persist for 2 weeks or more, they warrant professional attention. Misinterpreting clinical irritability as simple teenage angst creates a barrier to action. It allows a serious condition to hide behind a mask of expected adolescent behavior. This moodiness myth often leads to the assumption that a teenager will simply snap out of it given enough time. Leaving adolescent depression untreated allows the condition to escalate. It is associated with a significantly higher risk for substance use and suicidal ideation. The long-term stakes are high. Statistics show that in roughly 70% of cases, untreated teen depression recurs later in life as major depressive disorder. Waiting for a teenager to naturally outgrow these symptoms is not a cure. Instead, it often allows the condition to mature alongside them into adulthood. Some teenagers hide their struggle behind what looks like success. This achievement mask involves using perfectionism and high productivity to mask internal distress from parents and teachers. We often use grades as a shorthand for a child's well-being, but high academic performance does not guarantee mental health. A student can be outwardly productive while being internally unwell. There is also the age mask, the idea that children are too young to experience depression. However, evidence-based therapies have been proven effective for patients as young as 8 years old. When we rely on report cards or young age to rule out the possibility of depression, the condition can continue to develop undetected. Recognizing the need for early detection, the American Academy of Pediatrics recommends routine depression screening for all adolescents starting at age 12. Despite this, many teens go unscreened. Time pressures during well-child visits often mean physical complaints take precedence, leaving no room for mental evaluations. Beyond systemic issues, parents often fear that naming depression or starting therapy makes it worse. But data proves otherwise. Evidence-based treatments like CBT show 50 to 70% remission rates and actively reduce suicide risk. The combination of limited clinical time and hesitation at home creates a diagnostic gap, leaving many adolescents with treatable conditions to struggle completely alone. One way to bridge this gap is to move the screening process away from the rushed environment of a doctor's office and into the home. This is where the PHQ-A screener comes in, a private 5-minute tool providing instant scoring, validated for children 11 and up. It identifies severity from minimal to severe. While not a final diagnosis, it gives families a reliable starting point for professional conversations. By using this tool at home, parents can bypass the time constraints of the medical system and look past the behavioral camouflage their teen may be using. Once the need for support is identified, the next step is finding accessible care. MentalSpace Scho provides a telehealth infrastructure specifically for K-12 students in Georgia. The program is designed for efficiency, offering same-day access to a diverse team of licensed therapists who coordinate directly with school counselors and pediatricians. To ensure that financial barriers don't prevent care, the program accepts all major insurance providers and offers services at zero out-of-pocket cost for Medicaid patients. You can start this process today. Take the free screener at chctherapy.com/mentalhealthtests or visit mentalspacescho.com to begin a family intake. Adolescent depression relies on remaining unseen. By replacing outdated myths with modern screening tools, parents can intervene early and help change the course of their child's future.